Hello everybody, my name is Nathaniel Seabury, here with another video blog about sickle cell. My face is swollen, I look like Professor Clump today, but I'll get to that later. Right now, I just want to do a little bit of educating people about what sickle cell is and what causes it and how to treat it and different stuff like that. So, first of all, sickle cell disease is a disorder that affects the red blood cells, which use a protein called hemoglobin to transport oxygen from the lungs to the rest of the body. Normally, red blood cells are round and they can move round and flexible so they can travel freely through the narrow blood vessels. The hemoglobin molecule has two parts, an alpha and a beta. Patients with sickle cell disease have a mutation in a gene on chromosome 11. That codes for the beta subunit of the hemoglobin protein. As a result, hemoglobin molecules don't form properly, causing the red blood cells to be rigid and have a concave shape like a sickle used to cut wheat. These irregularly shaped cells get stuck in the blood vessels and are unable to transport oxygen effectively, causing pain and damage to the organs. How do people get sickle cell disease? See, that's a good question because a lot of people don't understand how people get sickle cell disease. So, sickle cell disease is inherited in an autosomal is inherited in a autosomal recessive pattern. This means that a child will not inherit disease unless both parents pass down a defective copy of the gene. People who inherit one good copy of the gene and one mutated copy are carriers. They are clinically normal but can still pass the defective gene to their children. And that's the part that people don't get. Okay, so if your mother has a sickle cell trait and your father doesn't, you can get the trait, but you won't get the disease. And it's not guaranteed you'll get the trait, but you can. Now, if your mother and father both had a trait, at least one of their children is going to have disease. And usually the firstborn child. In my case, it was me, the secondborn child. But for the most part, it's the firstborn child. Third, if both of your parents have sickle cell disease, all of their children are going to be born with sickle cell disease, which is not a good thing. But, some people still do it. Can't judge them for it because you can't help who you fall in love with. But I would never bring a child into this world to have the pain that I deal with all the time because that's horrible and cruel punishment. Okay, so back to what I was saying. The symptoms of sickle cell disease. This is another thing a lot of people don't get is, I always hear that, you don't look sick, blah, blah, blah. Well, there's a reason for all that. Let's see. Sickle cell disease prevents oxygen from reaching the spleen, liver, kidneys, lungs, heart, or other organs, causing a lot of damage without oxygen. The cells that make up, causing a lot of damage. Without oxygen, the cells that make up these organs will begin to die. For example, the spleen is often destroyed in these patients, resulting in some loss of immune function. As a result, these patients often experience frequent infections. My spleen is gone. It left me a long time ago. The sickle cell destroyed it. So, and I've also had, my kidneys have been attacked. My lungs have been attacked. Let's see. My heart, I've been through a lot, and it's been a long, long road. But let's just keep going. Let's see. The red blood cells of patients with sickle cell disease don't live as long as healthy red blood cells. As a result, with this disorder people with this disorder often have low red blood cell counts, which is anemia, which is why the disease is commonly referred to as sickle cell anemia. When sickle-shaped red blood cells get stuck in blood vessels. This can cause episodes of pain called crisis. Other symptoms include delayed growth, strokes, and jaundice, yellowish. That's a yellowish hue to the skin and eyes because of liver damage. Because of these complications, people with this disorder are likely to have their lifespan reduced by about 30 years. Now, your lifespan with sickle cell, I think, is one of the main reasons why it doesn't get national attention. Because, cancer patients get sick, people can pretty much guess or try to guess when they're going to die. Whereas people with sickle cell, they can tell you a number, but you never know because sickle cell doesn't have an expiration date. You live with it till you die. So, in actuality, you're dying every day of your life because it's killing you from the inside. You just don't know when it's going to kill you physically. I mean, from the outside. You know what I mean? Like, whatever in you is being attacked all the time. So, you don't know when it's going to stop. There's no expiration date. You could be 1 or you could be 80. There's really no expiration date. So and how do doctors diagnose sickle cell disease? Most states routinely screen newborns for sickle cell disease with a simple blood test. If the disorder is not detected at birth, a blood sample can be used in a test called hemoglobin electrophoresis. Electrophoresis. This test will determine whether a person has sickle cell disease or whether he or she is a carrier of the faulty hemoglobin gene. And that, that pretty much explains itself. How is sickle cell disease treated? Babies and young children with sickle cell disease must take a daily dose of penicillin to prevent potentially deadly infections. Patients also take folic acid, which helps build new red blood cells. Doctors advise people with sickle cell disease to get plenty of rest, drink lots of water, and avoid too much physical activity. Blood transfusions that provide a patient with healthy red blood cells are a common treatment. People with more severe cases of the disease can be treated with a bone marrow transplant. This procedure provides the patient with healthy red blood cells from a donor, ideally from a sibling. Here's some interesting facts. Wait, before I move on to interesting facts, I used to take penicillin. I took I still take folic acid, and I don't get a lot of rest because I'm usually in a lot of pain at night, so I don't sleep that much, which is bad. And the older I'm getting, I really can't. I used to love physical activities. I used to love running, playing football with my son, and all kinds of stuff. But my body's getting so bad now, I can't really do anything physical. If I run or do stuff, I wind up hurting and having pain crisis. So that really sucks. But, gotta do what you gotta do. And the bone marrow transplant, I could get one, and it might work, but if I were to get one and it didn't work, that would be a whole other disease that I would have to deal with. I forgot what it's called, but it has something to do with when your body rejects the kidney. That means you have to be on medicine the rest of your life just to live, and you get worse off than you are. So for a person my age, the risk is not worth the reward because if it fails, I might die. I know how to handle my sickle cell. I'm not ready to handle anything else. It's too much. Let's see. Here's some interesting facts about sickle cell. Unlike normal red blood cells, which can live for 120 days, sickle-shaped cells live only 10 to 20 days. In the United States, the disease most commonly affects African Americans. About 1 out of every 500 African American babies born in the United States has sickle cell anemia. Sickle cell disease is most common among people from Africa, India, the Caribbean, the Middle East, and the Mediterranean. The high prevalence of the defective gene in these regions may be due to the fact that carriers of a mutation in the beta subunit of hemoglobin are more resistant to malaria. Malaria is a disease that causes a parasite that is transmitted to a person when they are bitten by an infected mosquito. The sometimes fatal disease is common in hot countries and causes recurring chills and fever. And now that's like a lot of information about sickle cell. So I hope that answers some of y'all questions, and if not, just leave a comment, and I'll answer some more questions. Or this is going on Facebook and YouTube. So if you have any other questions, just leave a comment, Facebook, YouTube, whichever one. But now we're going to talk about what's going on with me for a minute. So I was in the hospital last week. Well, not last week. Week before last. What's today? Okay, yeah, it was week before last. I was in the hospital, and my face was swollen. You can see my video blog. It was all swollen in that too. But my face and body is swollen up, and ever since I got this thing in my chest, I've been having a little bit of complication. Like my body's swollen up, like it is now. Got me looking like Professor Clump. But they can't find out what's wrong. They don't know if it's my kidney shutting down or if I have a blood clot. They don't know what's going on. So when I was in the hospital last week, I told them that my face swollen. Nobody wanted to believe me. I know how my body looks. So they sent me home. I was home for about a week. I got the blood exchange they gave me on Monday, and then I came home, and that Tuesday the pain just started kicking in, and then I was swelling up really, really big like I am now, but a lot worse because my eyes were swollen. Everything was just really big. So I came back to the hospital, and they admitted me back into the hospital once again because my pain crisis was really bad, and they been running all kinds of tests. They've done ultrasound, MRIs, CAT scans. Now they're going to do this surgical procedure where they stick a needle or a catheter in me and they shoot the eye in me just see if they can find a blood clot because the ultrasound didn't show all my veins. God knows I'm hoping I don't have kidney failure again because that really sucks. It sucks like hell. But all I do now is pray because I'm scared. I'm scared of what's going on with my body, and it's really hard to talk to people. That's why I started doing these, because it's hard to talk to people about it, because I try to be strong in front of everybody, but I'm scared, man. I'm like really fucking scared that something's gonna happen. I'm not ready. I'm not scared to die. I'm scared that I'm not gonna be able to see my kids anymore, and it sucks, man. It sucks. I'm scared. I don't want to disappoint my kids. I don't want my kids growing up not knowing who their dad is because he died when they were little kids. I don't want none of that. So today I have to have this procedure to get checked out, and hopefully they tell me something good and not just be something bad like all the time. But sickle cell has had a profound effect on my life. It's not all bad. Like if it wasn't for sickle cell, I wouldn't be the person I am today. Because I look at people, I'm on Facebook and I'm reading people's, all this petty bullshit that people